If you're experiencing pain and stiffness up high near your sit bones, chances are you're experiencing symptoms of proximal hamstring tendinopathy. This injury can be difficult to treat. Let's discuss some management strategies for how to get over these symptoms. In this video, we're going to discuss the following topics. What is proximal hamstring tendinopathy? Why you shouldn't be stretching this injury? How do you go about getting rid of this injury? Should you be running if you have proximal hamstring tendinopathy? Are there gait modifications you can try to help reduce stress to this area when you run and when you walk? And finally, I'm going to go over a case study of my own personal experience with recovering from proximal hamstring tendinopathy. What were the exercises that I used to help with pain? I'm going to go over that at the very end. Some early hallmark signs of proximal hamstring tendinopathy is a deep ache and sometimes just stiffness up high and deep in the butt. Typically, the symptoms will start appearing after you sit for long periods of time, especially after doing strenuous activities such as running, heavy lifting, or doing some type of activity that requires you to do lots of repetitive bending. The most important thing to know about this injury is that if you don't catch symptoms early, oftentimes this can be a persistent issue that lingers for months on end. I actually had my own personal experience with this injury last summer when I was training for a race. At the same time, I was also working on a big landscaping project around my house. Thankfully, I was able to get over most of my symptoms within 3 weeks of developing the symptoms. However, I know that oftentimes this typically isn't how the story goes for most people. My injury was a classic example of the demands of the activities I was doing at the time, placing lots of load through my hamstring through both running hills. I was training a lot of hills at the time, and I was also doing a lot of bending and shoveling with my landscaping. Those two activities together, done at around the same time, was just too much for my hamstrings to handle at the time. This is really how all tendon injuries start. When the cumulative loads that you place on your tendons through exercise and as you go about your daily activities, when these loads exceed the tendon strength capacity, you wind up with tendon pain. When irritated, tendons do not like activities that cause them to compress and work over bony prominences. Activities that wind the proximal hamstring tendon up, compressing it over the sit bone, are activities such as sitting, especially when sitting on firm surfaces that place the knees even or higher than the hips, stretching while keeping the knees straight, overstriding or leaning excessively forward when you run, and running and walking up hills. An easy self-test you can do to see if you have proximal hamstring tendinopathy is the shoe test. For this, you want to really lean forward with your trunk while keeping the affected leg straight and using your opposite foot to kick your shoe off. With this, you're actively using the hamstrings on the lead leg to pull the shoe off. This will often reproduce pain and stiffness near the upper hamstring tendon in someone with proximal hamstring tendinopathy. Another often provocative movement is any type of a straight knee deadlift. This also can be used as a test to potentially rule in proximal hamstring tendinopathy. When I'm working with patients who have this injury, I often have them use these types of self-tests as ways to track improvement in their symptoms over time. If you're headed in the right direction with your rehab, you should see slowly over time that these tests become less and less painful. Even though you may feel tight in this area, you need to stop stretching. Many people mistakenly try activities like yoga to help with their symptoms, but typically this will only make symptoms worse. If you're going to stretch, work on stretching the hip flexors on the front of the hip. When these are tight, the pelvis will roll forward easier, causing the upper hamstring tendon to wind up over the sit bone. This is a movement you don't want happening with this injury because this causes extra compression of the tendon over your bone and also places the hamstrings in a lengthened, less advantageous position. If you really want to get the most out of your rehab for this injury, you have to modify activities to help reduce the overall cumulative loads experienced by the proximal hamstring tendon. The reason you experienced the injury in the first place was because the stresses you were placing on your tendon exceeded its strength capacity. If your capacity was fairly high before the injury, it's important to know that now it's even lower, and you need to modify your activities accordingly so that symptoms don't prevent you from getting stronger and returning more quickly to your normal activities. These are all modifications you can try doing throughout your day to help offload the proximal hamstring tendon. By really making a point to pay attention throughout the day to these things, you will be much more successful at lessening the overall cumulative loads experienced by your hamstrings each day, which will in turn potentially allow you to squeeze a little bit more of the activities you enjoy doing, such as running, lifting, or even gardening and yard work, into your day without risking overdoing it. Before answering the question about what exercises are best to do for this injury, and also should you be running when you have this injury, it's first important to answer a very critical question. Are you in more of a pain-dominant state with your injury, or are you in more of a load-dominant stage with your injury? The reason tendon injuries can often linger so long is that oftentimes the underlying tendon weakness never gets addressed with the right strengthening work to help restore load capacity to the affected tendon. The cycle that you absolutely don't want to fall into is that your only response to tendon pain is to rest it. This will set you on the all too familiar continuous cycle of pain, rest, reduce capacity, repeat. When this happens, you can develop more of a chronic type of a tendon injury that results from progressive weakening of the tendon due to doing less and less activity over time because of pain cycles. Those are the fibers that give tendons their outstanding strength properties. What happens is those can become, normally they're aligned in parallel, those can become really disorganized, and when that happens, the tendon gets weaker. Now the good news is that actually only happens in little patches within the tendon. Once those changes happen within a tendon, they do not change. The good news, however, is that with strength training, you can actually reinforce and lay down new, strong collagen around the weaker areas of collagen. The real ultimate problem with having weaker patches of collagen within your tendons is that your tendons over time lose their capacity to handle the loads that you place on them with your daily activities and your exercise. If you're struggling with persistent stiffness and mild aching in your upper hamstring after bouts of physical activity or after long periods of sitting, but are still able to mostly run and walk with little to no symptoms, then chances are you're in more of a load-dominant state with your injury. This means that you need to load and strengthen this tendon more than you do with just your normal daily activities to help improve the load capacity of your hamstring tendons. To really improve your strength capacity, you need to commit yourself to doing a 10 to 12 week targeted strength program focused on improving hamstring strength and the strength of several key helper muscles. To get the hamstring tendon stronger, you need to pick exercises and exercise intensities that really challenge the hamstrings and that emphasize the lengthening phase of your contractions. For the hamstrings, it can be helpful to use a rate of perceived exertion scale to ensure that you're working hard enough during your exercises. On this scale, you should be working at around a 7 to 8 out of 10 on this RPE scale by the last 5 to 10 reps you do for each set. As you recover between sets, this is a prime time to work on exercises that improve lengthening on the front of your hips and control through your pelvis. The goal with this is to work on controlling the forward tilt of the pelvis that can place extra compression stresses on the upper hamstrings. If you wake up with significant pain near your upper sit bone after doing something strenuous to the hamstrings, and it takes you a long time to walk this pain off after sitting still for a period of time. If your gait is altered and if you can't do any type of running or hill work without developing a building noticeable ache and pain near your upper sit bone, then chances are you're in a more pain dominant state with this injury. This occurs due to actual chemical changes that take place in an overloaded tendon. These changes can take several weeks to settle. No matter what you do, you can't speed the settling process up because there's been chemical changes within the tendon. You can, however, definitely slow this process down if you don't take time off from activities that are going to strain the tendon. Runners, unfortunately, when this happens, you have to take some time off from running with proximal hamstring tendinopathy, or else this can become a much bigger, longer lasting injury. When this happens, the tendon can enter what's called a reactive state. In a reactive state, you have actual chemical changes that happen within the tendon that draw water into the tendon, causing it to swell, and this can be super painful even when you're doing just simple activities. If you're in more of a load dominant stage, then you should be able to continue some degree of easy running. It's wise, though, to probably cut your weekly mileage in half as you work on strengthening your hamstrings so they have a better chance at adapting to the strength work you do over the next several weeks. It's also best at this time if you avoid running any hills and cut out all speed work. If you continue running and strength training at the same time and don't see any improvement in your pain after 2 to 3 weeks, you should probably consider taking 2 to 3 weeks off and focus on strengthening only to see if that makes a difference in your symptoms. When you are out on a run and you start to feel symptoms in your upper hamstrings, make sure that you follow these pain monitoring guidelines. Sometimes you might start out with pain, but then as you run a little bit more, the pain goes away. This is typically how tendons usually present. However, if pain starts creeping up again later in your run, you can follow these pain monitoring guidelines to see if you need to make any changes. If your pain rating stays in the green zone, then you should be fine to continue what you're doing. However, if you can control your symptoms by modifying your gait, you should try to do so. These tips are commonly helpful for reducing stress to your hamstrings and improving symptoms when you run. Drive your hips forward to reduce forward lean, or try increasing your step rate to reduce your stride length. You can also try switching to run-walk intervals to finish out your run to help reduce the effects of fatigue on your running form and hamstring muscle performance. Now we've come to the end where I get to share about how I got over my own proximal hamstring tendon injury and how I went about getting back into running. When I developed my symptoms with proximal hamstring tendinopathy, I first noticed the symptoms towards the end of a long run where I was doing a lot of hills. In the days leading up to this run, I had been doing a lot of landscaping. I was bending over, picking weeds, digging, doing lots of bending, lots of active use of my hamstrings in a stretched bent over position. After symptoms were stirred, I was able to walk mostly without pain. When I would sit, sometimes I'd get just a real mild ache high in my sit bone. But overall, I really didn't get that flared up with my symptoms, but I was flared up enough to know that I couldn't do both running and landscaping. I ended up taking about a 2.5 week break from running so that I could finish my landscaping project. When I did my landscaping, I tried to make a point to do a lot less bending and a lot more kneeling and using of my knees. This helped quite a bit with my pain, and I was able to successfully return to normal running after I finished that project, and then a couple weeks later, after starting back to flat, shorter runs, doing a small amount of hill training while gradually building up some of my longer runs. I was able to do that without any type of setback. I credit being able to do this without any real setbacks to two main things. Number one, respecting my pain when I was close to developing a reactive tendon injury by taking a little bit of time off from running. Number two, managing how I was loading my hamstrings with my daily activities. In the early stages of my injury, I also got a lot of relief from doing hamstring isometrics regularly throughout the day. I used these exercises as medicine throughout my day when I would experience aching in my upper hamstring. Just like medicine, you can use these types of exercises to help offload the tendon to give it some relief. With certain types of tendon injuries, isometrics can be very beneficial for managing pain, and proximal hamstring tendinopathy is definitely one of them. For me personally, I never really had to do any official strengthening program for my hamstrings other than isometrics because I never struggled with persistent issues after those first 3 weeks. This, however, is often not how most people will experience this injury. If you've had your proximal hamstring tendon symptoms for months and months, then you need to definitely dedicate a good 8 to 12 week block of time to specifically working on and progressively loading your hamstring tendon. This will help improve the capacity and overall load tolerance of this tendon and make it less likely to become sensitive when you do things that stress it in the future. If you like this video, please make sure to subscribe to my channel and share this video with a friend who might be struggling with this injury.